June being Men's Health Awareness Month, we're taking the moment to look at some of the issues that affect men. Prostate health is always a big issue, and often men don't get regular checkups when it comes to that. Dr. Samuel Haywood, a urologic oncologist with the Cleveland Clinic, joins me today to talk about the latest in prostate health. Thank you, doctor. We appreciate it.
Thank you for having me.
So how early should men start to get prostate checkups?
Sure. So for men that have average risk for prostate cancer, we say that they should be screened starting around age 55, and that continues until age 70. Now, men that may have a higher risk of prostate cancer, which can include men with a family history or Black men, we do think that they should start a little bit earlier. Now, usually around age 50 or about 10 years earlier than their youngest relative that did have cancer.
Got it. How much can an early diagnosis affect the success rate when treating prostate cancer?
It can certainly affect it greatly. We know that when prostate cancer is found, when it's just confined to the prostate, it's a very, very treatable disease. And unfortunately, if it's already spread beyond the prostate, we have much more difficult time, being able to cure it. And so, it's really one of those circumstances where, a few minutes of a blood test can really save a life.
And it's amazing how much treatment for prostate cancer has advanced over the years. Even if you are diagnosed at stage 4, there is hope. Can you explain what some of the latest options are?
Exactly, yeah. And to your point, even if things are advanced when we diagnose it, we still, think that there are many lines of treatments. And while we may not be able to cure it, we can give patients, several years. To your question about the treatments, if it's localized just to the prostate, we're able to do such things as surgery or radiation to the prostate. If it's advanced, beyond the prostate, at that point we're looking at more, systemic options throughout the whole body, such as hormone treatments, chemotherapies, or other sort of immune therapies.
What is your advice to men when it comes to prostate health?
Sure. My advice to men is to talk with your doctor and make sure that you're getting screening, not just for prostate, but for all sorts of health conditions, to really make sure that you're staying ahead of your health.
And of course, that family history, trying to understand if you maybe have a family history of it, correct?
Of course, yeah, that's a really great point. We talk about, with women's health and breast cancer, a lot of women are much better at knowing their family history, and men just don't talk about it as much. And so I really encourage guys to talk to their family, know your history, know your family history, so that you can best direct your screening.
Overall message with this that maybe people may not understand, or are there any myths surrounding prostate health?
Yeah, I think, with prostate health and all sort of urologic issues, people often think of it as something dirty or something you don't talk about. And it's one of those things where, we really can help guys if we're talking about it. And so I'd say the biggest myth would be that you don't want to talk about it.
Correct. Yeah, no, that's a big reason why we're trying to promote this and obviously raise awareness around it. So Dr. Haywood, thank you for taking the time for us with this important information. We appreciate it.
Of course. Thanks for having me.